Good afternoon and welcome to Customer Engagement Under a Pandemic, a PPP approach, paper process evolution from paper to practical. I'm excited to have our colleagues from the DC Department of Health, and I'm going to just be really brief and quick and introduce them. Ann Pierre, Monet Thomas, and Dawan Wade. She'll get me for that. They'll be presenting their most recent innovation, and we're excited to have them on and excited to hear how things went with the PPP approach. I will turn this over to Ann.
Thank you so much, Damon, and good afternoon, everyone. Just one correction, particularly for the recording. It's the DC Department of Human Services. We don't have health in front of our name, so it's DC Department of Human Services. And I want to begin by bringing us back to 2020, which was a memorable year to each one of us here today in this room. The pandemic caused human services agencies to quickly pivot in its service delivery to residents and to create continuity of operations plans, which were constrained by the mission of our respective agencies. And this was true for us here in the District of Columbia. As Damon said, my name is Ann Pierre. I am the Deputy Administrator for Customer Workforce Employment and Training. And I'm joined today by my colleagues, Dawan Wade and Monet Thomas Conyers, who you will be hearing from as well during today's presentation. In today's presentation, we'll be sharing DC's PPE approach to addressing work participation challenges as a result of the pandemic. We all know about PPE, whether it's in our personal life, where we wear our gloves, our face shields, our masks, and we felt it was necessary to use PPE in our service delivery. So I want to open our presentation today with reminding each one of us here about our agency's mission. Next slide, please. And for those particularly who would be listening in on the presentation, I'll just read it out. The mission of the DC Department of Human Services is to empower every district resident to reach their full potential by providing meaningful connections to work opportunities, economic assistance, and supportive assistance. And we were faced with a situation, and the situation that we faced in DC, next slide please, was COVID-19. What was the right thing to do with COVID-19, and what was the presenting issues? The presenting issues were there was a public health emergency and economic crisis, which was created universally throughout the world. And DC was not exempt from that. And we had resulting stay-at-home orders for businesses and schools, resulting in reductions of income, which of course resulted in an economic burden for many of our residents that we serve. And the unprecedented number of unemployment insurance applications being filed in the district. And just to provide you with some data, between March 2020 through October of 2020, a record number of 148,794 DC residents applied for uninsurance assistance, which was approximately 22% of DC's total workforce. So just think of that number and the economic crisis as a result of the situation, COVID-19. So we wanted to, in DC, what was the right pathway? What was the right approach that we should use, particularly in our employment and training program? And we landed upon three areas that we should focus upon. One was bridging the digital divide. The other was addressing the economic crisis. And the third was contactless reporting. What does that look like? In DC, our work participation, our work verification plan, we decided that, we outlined that we would do 100% audit, and that audit would have supporting documentation to match each hour of participation. So we were far from paperless pre-pandemic and into the pandemic. And it was decided that that approach was not going to be relevant to the condition, the situation we were experiencing, which began in March or earlier than March of 2020. Next slide, please. So how did we bridge the digital divide? I'll be talking on bridging the digital divide. How did we in DC bridge the digital divide? And if we created an initiative targeted towards DC TANF Employment and Education Program customers, which we usually call the program TEP, T-E-P, TEP. And this was to provide social and economic opportunities to customers by offering affordable computers, internet services, and digital skills training in an era of the COVID-19 pandemic. In many states, the digital divide is something which plagues most of our low and moderate income residents, and this was true in DC as well. And there was a greater need we identified in the district, as many of you in your states would have identified, for customers to have access to computer technology to just exist. We have to perform certain tasks here, but just to exist, because during the pandemic, everything was shut down. We were forced to do shelter in place, so to speak, and social distancing. So how do we communicate? How do we get continue, how would our customers continue their training programs, even their employment activities? So so we just have a pictorial of our pushing it initiative. Next slide, please. And we have another graphic which was sent out to our customers. With the education and employment program, providers can use discrete work-related expenses. In our TANF, our employment and training program in DC, one of our payment points and in how we incentivize our customers and our providers is by the discrete work-related expenses. This is typically $250, which is open to each customer participating in the program within a 12-month period. And prior to the pandemic, this discrete work-related expenses fund was used primarily to set a customer up for the start with any customer with a firm job offer, to start them with employment. And so it was basically used for uniforms, any test or anything required to start employment. But during the pandemic, we expanded it to include purchase technology, which is laptops only, internet only, or as a bundle package. They can use their discrete work-related expenses of $250 as a bundle package with internet service through Comcast, Octo. These are some of our partners that we worked with during the pandemic to supplement our Digital Divide program. Next slide, please. And now I'll turn it over to Dewan, who will talk about how we addressed the economic crisis. Dewan.
Thank you so much, Anne, for that. That was a really great segue into this next piece where we started to discuss how we would get our arms around the economic crisis that was taking place during the same time we were looking at how best to address the digital divide. So as we're about to go into this next section, what I'd like to do is, for those of you participating in this presentation with us, this is a great space for us to look at a conversation that we had to have during this time. And Monet, can you help us here in the chat? We wanted to look at how you approach it. If you can go to the next slide, that would be helpful. How we approached the situation with our families. So we have how you approached technology at that point, which really started us to have a deeper conversation. So in the chat, you'll notice that there's a short survey we're asking you guys to take. It'll take about less than a minute. And we want to get the feeling, when you're approached with new technology, what's the initial reaction that you have? Whether that's a system, whether that's a physical piece of technology, or a platform that someone's asking you to then use within a short period of time. These were questions that we had to ask ourselves at this point in time. Yes, we could provide computers and laptops if the situation allowed us to. And yes, we could also think about ways of bridging the digital divide with internet access. But there was one thing that we had to think a little bit deeper about, and that was the learning curve of how to really use that laptop in the home if most of our families are used to using used to using cell phones. The interface is a little bit different. And so that was something we had to consider. And so what we did here was the 2-gen incentive model. We realized that families were really intuitive and they were really resilient in this time. And so a couple things took place. With the emergency preparedness plan, we looked at ways that we could continue to keep our families engaged. We had a good amount of families who were engaged, but we also wanted to work with families who may be thinking about falling off because they wanted to address safety at that point and what was happening with their homes or what may be happening in their homes. Also, we wanted to look at the 2-gen model because this was something that the agency had begun to pivot to, and we had really started to integrate it into a lot of our programs, outward facing and looking at ways that we could look at our policy a bit more, to look at ways that we could tie that into our policy. And we were starting to ask those questions, but at this point, we really needed to dig in a little bit deeper. So along with all of that, hopefully in that survey, you'll recognize the questions that are being asked. These are things that we might not think about because we're more physical with the technology that we're faced with. Using that approach, when we're thinking about 2-gen, we looked at all of the core components of 2-gen. We looked at the health and well-being of our families, and we started to ask them questions. What are things specifically that we can do to support you during this time? We asked the same things of education, and we ask the same things of their social capital. What do their networks look like right now? How can we get our arms around that? We started looking at ways that the families could really connect with their closest circles. We looked at ways that they could really get connected with housing providers or home providers, which in DC, it's Virginia Williams. We looked at ways that they could really build up their resources during this really difficult time. And so we started to look at ways to incentivize that financially. Monet, could you go to the next slide, please? The image may be a bit small, but what we did here was we looked at activities that families could most definitely do and be active in doing and engage with their providers, their education and employment providers, and most definitely keep that line of communication open during that time. We started to look at activities that they could do, and we looked at how frequently they may do them and keep that balance in mind while having these difficult discussions. How could we balance out the amount of families that may be impacted while making sure that they are going to keep the motivation that they need to moving forward, to making sure that kids are able to engage in online education so that they're able to look for work or stay engaged in school. And so all of these things were considered. The 2-gen incentive model really did help our families. We had a number of customer engagement groups where we were able to hear families and what they needed. This was everything from needing groceries in the homes and providing those resources from local organizations in the district. This was making sure that they could reach out to Virginia Williams for housing resources if they needed it. This was making sure that they could reach out to their local, whether it be a church, if this was a kitchen in the neighborhood for other resources, and also the utility assistance programs. This was a lot of these resources were able to bridge the economic divides that a lot of our families were facing during this time. Monet, could you move forward, please? So just to wrap up that section, these were some of the conversations that we were having along with bridging that digital divide. So while we wanted to bridge both of those areas, a lot of the conversations that we were having, we're still having today. So I would like to change over the conversation and transition to Monet.
So when continuing that conversation, we've talked a great deal about the digital divide. We've talked a great deal about how to systematically look at the ways in which we incentivize our partners, our customers. But here's the thing. As Ann mentioned in the very beginning, we needed to make sure that we shifted the conversation from paper and literally looking at how we define PPE in this space, the paper process evolution, and looking at the e-doc and e-signature component and how that might best suit our customer base. And so in this space, we're going to transition the conversation into how we managed to merge two systems. The very first one is a seamless doc platform, and how we were able to move that conversation with using that particular space into a portal. As I made mention of before, the customer portal. Now, in 2016, and actually the two persons here, the other presenters, were instrumental in even birthing this idea, thinking of a way in which the customer base would be able to create and have a portable workstation. This workstation would allow our customers to upload documentation and input data, a way in which they will be able to communicate with their TEP partners, case managers, service provider managers. Originally, the project was coined the DC WET Customer Portal. However, it's transitioned because we wanted to make sure that we consider the customer base and names in which are more familiar with those that are working with that space. And now you will see the transitions into it being called the TEP Customer Portal. This digital communication system is defined as a secure system that enables both DHS and primary providers the ability to exchange information. Here's what we found. We needed to make sure that we were able to further empower our customers to address both the access and the equipment, along with ensuring families could use the technology. Okay, so that's that digital divide conversation. Taking the conversation a step further, we also needed to recognize that our families were primarily focused on safety and stability. All of us can relate to that. And then third, we wanted to make sure that we revamped traditional engagement with TANF employment and educational program services. Because here's the idea. We all believe that at some point, the way that things are currently, as we're experiencing this pandemic, will be lifted. And so as a result of that, we not only want to consider the current and the now with our customer base, but also how it will transform and impact our future engagement. We want to transition now to actually look at both the customer portal, and I may have neglected to mention something. There's a partner system called the middle application. To give you a little bit of detail about both of those systems and how they currently operate. So the TEP customer portal is an application. It allows our customers to submit and upload seamless documents and supporting documentation for work activity related compliance. In partnership with that system is the middle application processing system. This is an intranet application, and it's specifically used for auditing and processing documents from the TEP customer portal. When we're talking about accessing these two systems, the customer portal, indicative in the name, is specifically used for our customers. It's an internet public-facing website. The customers are able to access this space using a URL, using any particular platform that they do have access to, Safari, Chrome, Internet Explorer. That is, however, not the case for users of the middle application. The reason being, we believe in the information that the customers are submitting from the customer portal needs to be handled with care. And as a result of that, we need to make sure that it lands in the correct hands. So every user of the middle application is required to access that system using their virtual private network number. And with that, either being a DC government VPN user or a provider user. I'm going to transition now to actually demonstrate what that particular space looks like. Can everyone see my screen okay? So continuing our conversation on the third strategy of the paper process evolution, our team would like to demonstrate the user functions of the customer portal and the middle application. The district felt it was important to build upon best practices and consider the lessons learned from building a benefits portal when developing the customer portal. One such discussion was in enhancing communication usability with the mobile device. At present, the target audience for the portal are TANF customers receiving TEP supportive services and case management services. To that end, registration is required for all users. Once registration is complete, users can proceed to the sign-in screen using the validated email and self-created password. Once in the portal, customers have the option of navigating to the home screen. Under the About tab, users learn of the purpose of the 6 modules currently found on the home screen. The district takes great pride in building, fostering, and nurturing the needs of the family, ensuring that users can access resources ranging from an assessment to additional benefit services. The portal offers users real-time information. Embedded in the design of the portal and middle application, for example, is an issue tracking system. The end user enters elements into designated fields. The responses are collected and addressed by a team of specialists responsible for assisting our customers, staff, and partners. Users will also have the ability to select their preferred language, manage their profile, and even change their password. The portal offers customers a self-password reset option. Focusing our attention now on the home page, customers have the option of selecting any one of the 6 modules. Our example is in the Universal Time and Attendance form. Once accessed, the customers will be redirected to the seamless docs version of the form. It's important to note that for every work activity form submitted, the portal will also allow our customers the ability to be able to attach a supporting document. So here's what we know. We know that our customers will not only just need to upload documents in support of, for example, a universal time and attendance form. So what we've designed in this system is a standalone supporting documents feature, allowing our customers multiple ways in which documentation can be submitted, authorized, approved, and submitted to their TEP partner. In the visual here on our screen, we'll see the process in which a customer will take to be able to add additional documentation and have that to support any of the 4 documents that you see above. One of the unique features about the standalone option is that it will allow the customer to select the specific provider that they're working with to ensure that the documentation will be received by that particular provider. Switching gears now from the customer portal, the middle application is designed for our TEP partners and our DHS stakeholders to conduct a document review and approval. The middle application operates under a single sign-on authentication services. With their credentials, users can access the documents submitted by a customer using the portal. The documents, referred to as batches, are made available to the provider, currently assigned to the customer for case management services. What users will find is that the collection of documents transmitted from the portal will be assigned a task ID. Users of the portal can always search for batches using this element and any of the 5 remaining elements that you see on the screen. It's important to note that once a task is assigned to the user, they'll be able to enter key information about the customer. Proceed to viewing the documents under the See the PDF icon located to the right and bottom of the screen, after which time they'll be able to determine if the documents are approved or denied. Once the user has entered information in all of the required fields, the documents should then be placed in the agency's data storage system by clicking on Submit All Docs. DHS's approach to the systems is a belief that we should be providing courteous and a professional response of what that product is. This approach helps us in our service delivery to our stakeholders and our customers, both internal and external. Coming back into the space, we just have to transition now. You've heard us talk quite a bit about what we've done. But here's the thing. We also recognize that in order for us to keep the conversations going, that we have to reach out to our partners, those who are also doing the work. And so we want to frame this next section in terms of asking a host of questions that we're hoping to engage in dialogue with you at this time. The very first question I'm going to ask if individuals can use the room chat. How do we strengthen our family's ability to balance home, work, and self-care? And I'm looking at the chat box, both Dewan and Anne as well. Damon, do you see any in the chat that we may be missing?
No, it was just the one question so far from from Sanjay in Region 3. Are the documentations self-attestations or are they verified by the supervisor? And Anne provided an answer, but if you could give a verbal one to those who may not have seen it in the chat.
Thank you, Damon. Yes, so the answer is in the affirmative, yes. Verification is still required by our case managers need to verify participation for any customer, particularly if the participation is conducted at a place other than the provider's location. And I did see one response to the question: how do we strengthen families' ability to balance home, work, and self-care? And Liz said, increase access to, increase access to childcare, parenting courses, self-care options, all examples. And Beverly responded, being flexible and sensitive to their needs. So we have two particular responses.
With regard to, I'll get to your next steps, but I had a question about the use of the mobile device. We know that more and more people are moving to the mobile device and not having any type of laptop or any type of computer at all. Did you find it difficult to, I guess, make that transition to using that mobile device, given that it's so small and people are always on the go with the mobile device and everything? Was it different to see people going from using a computer to using an actual handheld mobile device to do everything that you outlined they could do, uploading documents and e-signing and everything?
That's a very good question, Damon. And I can start. And I see Daywan took herself off mute, so I'm sure she would like to respond as well. Just for the participants today, I'd like to just frame it in that when we, in the employment and training program, rolled out the customer portal, DHS had already rolled out the application process where residents could apply for benefits, and mobile devices were one of the platforms that they can use. So we found it was a seamless transition. To date, we have not had much pushback or any grave concerns that we could not address within our organization for the employment and training program. So there was little pushback because of the mobile devices. We ensured we tested it with our IT partners internal, particularly to ensure that all platforms it could work on any platform that the user is using. Dewan?
Yes. So to Anne's point, yes, we did test it over and over again. And so it was extremely helpful to not only reach out to a number of our customers and a number of our providers who had the opportunity to use different devices to test the platform, and knowing that the agency does have a platform where our families can apply for benefits in that way as well. But it also allowed us to see how many devices were in the home and if there was one needed. So that was also a space for us to start that conversation, because it was a lot of our families were under the assumption that they had to use a computer, and they did not. And our families are on the go. So it was a lot easier for them to say, yes, I have this information on my phone. I could log in. I can upload a version of the supporting documentation that I need, and I can keep going. I can communicate with my case manager. I can let them know what's going on, and anything else that's needed, it's right here in my phone. Everything that we're doing right now, we have the capability to do from our phones, and we're going to continue to look at that and how flexible we can be in easing some of that burden of needing to use paper heavy processes.
Right. And I'd also like to add that we did have some forward-thinking customers prior to the pandemic who were already using their phones to submit documentation to providers. And of course, that was a little ripple in the whole scheme of things, because we hadn't thought about what was possible. So, I just think it's a natural complement to what the agency is doing in the Combine app for when a resident is applying for benefits, and what we are doing to complement that. Thank you. And I see we have a few more questions, Damon. I'm not sure if you're going to
couple in there, but I want to piggyback on that most recent answer with how did you engage your customers with low literacy levels, not just reading and math and stuff, but I'm guilty of being low tech literate. Did you offer classes? Did you offer technical support, or how did you engage the different types of people that will be now making this transformation?
Monet, you want to take that?
Do actually.
From the
So
training.
what we found was that we heavily relied on the relationships that were established with our partners. And they were the ones who were very vocal about just that exact question. And because of that, we prepared tools, those that can be used in a one-on-one sort of orientation with the customers to help guide them with how to use the portal. Because here's the thing, the seamless doc application, for example, and taking that conversation about e-signature and e-doc was the first sort of evolution, right? In terms of this conversation of pushing the conversation forward with our customers. The portal is a whole nother thing. And so that quote unquote trauma, right, that could be experienced in a short period of time, to mitigate that, our partners are helping a great deal. And so those established relationships are helping to address that question. However, it's a larger concern that as an agency, again, as you can see, it's one of our questions, right? Just how do we look at that, knowing that as Anne mentioned before, we had customers forward thinking. There are some that we know were using their phones, using multiple means of engagement with their providers to maintain not only compliance, but being in line with that relationship. So we don't want to falter or debilitate one relationship while trying to look at another one. So we want to make sure that everyone feels supported in some way.
If I can just speak to Sanjay's question and then Anne's response just a little bit there, we did notice that we had a lot of customers who were really focused on the economic assets component of 2Gen, and they really wanted to focus on the safety and security of their homes. And so that was something that we wanted to really make sure that was well addressed. But I do see Anne is also responding to it, so I'm not gonna worry about it. But I just want to I see that she's already responding to it, so I'll go ahead and just the part that I've already shared there is we did make sure to cover each core component of 2Gen, and we wanted to make sure that those activities spoke to the customers and to keep that open dialogue there. So we make sure to not only just stay within our bubbles, but what are the customers looking for? What are they saying? Where do we need to have deeper conversations? And who's the best person to have at the table when having those discussions is really important to remember. But other than that, I see the responses are coming in. The questions and responses are happening in the chat. So to that, I think that question is being answered.
You're not going to get off because I'm still going to ask questions. Our colleague Don, I hope I pronounced this correctly, Danielle Livingston, is the $250 amount a one-time benefit? And if so, did you find participants not able to continue due to the lack of funds?
I'll take the first part, and then Damon or Monet can take the second part of your question, Damon. It's $250 every 12 months. So as long as the customer is engaged with their provider, they are eligible to receive this payment point of $250 under discrete work-related expenses. As I indicated in my presentation earlier, the $250 pre-pandemic, it was basically used to onboard a customer with a firm job offer. So someone had a firm job offer, they needed, but let's take security, the field of security. They needed uniforms, they needed different things, maybe a test or something, blood work, to start that job. And that's where we lived. That was the space our discrete work-related expenses of $250 lived, to onboard someone with a firm job offer. But with the pandemic and to address the digital divide, we felt it was important to include in that discrete related work expenses, access to laptop or the bundle package. So it's not going, the second part of your question, Damon, did you want to talk about the second part?
The second part of the question, so the second part was whatever was remaining from that $250 within that 12-month period was still available to that customer, but they did have access for the laptop and internet access. So they still have access to it, and they still have access to other resources. So we're still having those conversations, and it's still in partnership with other groups within DHS and other agencies. So whatever feedback we do get through customer engagement, we usually try to get it to the units and divisions that are going to make the biggest impact and be most effective in getting that either changed or having those discussions that are going to move that conversation forward.
I see Sanjay's question, but I want to ask one with regard to the 2Gen aspect of the initiative. Were there specific activities or investments you made for the children of the customers that you were giving giving these additional and new supports to?
Could you clarify the question? Because I'm trying to follow it in the chat.
So with the 2-gen strategy, it's always been thought of that it's making investments in the parent and the child, or the previous generation and the subsequent generation. So I was just curious that in this strategy, did you offer any particular supports during this crisis period for the children? Did they receive any training or any resources or any supports different than they had been receiving previously, while the parent is now getting the laptop and the different supports?
I'm not necessarily sure how to respond to the question, because a lot of the activities that we looked at, and we can go back to the slide that has the activities that we've listed out, but a lot of them directly include the children and parent. So it is a holistic approach where nothing is being done without the children there. If we're engaged in an activity, or we're going to an event that maybe addresses health and well-being, then the mom or dad is there with the child. If it's, we're going to a doctor's appointment, it could be the child's doctor's appointment that has a direct impact on the child. We want to make sure that that's also included. So that's inclusive, right? So making sure that there's a roof over mom and dad's head, that has a direct impact on the child. Educationally as well, virtual learning, and making sure that the parent is able to engage and connect with the teacher, that makes sure that everyone is at the table and on the same page. And if that is done, then the child is able to succeed. So we're addressing everything in that one space. So it is making sure that the child is always a part of the conversation. And so that in itself is the 2-gen or multi-generational approach.
And if I do recall, health and well-being, that particular cog during the pandemic had most of participation and engagement there. The parent could, which including the child, could participate in an activity, just as maybe doing a yoga class or doing any form of exercise. Just providing something to show that you and the child were engaged in that activity, going for a walk, because we were social distancing and we had our own bubble. So going for a walk, just show proof, picture of a tree or something, to show that you were, we ensured that whatever was provided to DHS did not include a visible image of the child. We took safety and security into consideration, but the children were all, by the mere nature of what 2-gen is all about, the children were always included. And as Dewan alluded in her segment of the presentation, the 2-gen initiative was really well received during the period that it ran. I don't know if Monet has anything else to add on that for 2-gen.
Nothing further.
So as the pandemic winds to a close or winds to its next phase, what's next for DC with regard? Are you planning on going back to much of the in-office, in-person type of stuff, or are you going to stay more on the virtual aspect? And what other things are on the horizon in the minds of the DC team as we move beyond COVID-1, I guess it was,
to COVID 2.0. Yeah. So one of the things we recognize, case coaching is very important and is so paramount, particularly now. We talked about case coaching. We want to veer away from case management. It's, instead of that old way of doing things, case coaching. So internally in DHS, we have a pilot where we have an internal provider, and that's an incubator for our case coaching. We have contracts with a well-known case coaching organization within on the national landscape, where we are providing our coaches there and case managers with skills to to enlarging their toolbox to know how to work with customers. Eventually, we hope to roll it out. That's a similar program to our contractors. So what will DC look like coming the next phase of this? What will we go back to? I think it's as we before the presentation we had a chat. Who's in office? Who's not back in office? We're still having business the district is open for business, as most of you would know, if not all of you. And the district government agencies are open, and the providers who represent DHS are also open for business. What that means is that some of them may have a hybrid, staggering staff into the office or not. That's going on. Is it my computer? Can you hear me? Yeah, thank you. So we are operating and we are accessible. Providers are accessible to customers. Customers can come in to locations, and some customers still want to come in. We talked about safety and security, but some customers still like this face-to-face interaction. So that's happening. And we are just here to empower our customers, empower our residents, and continue providing meaningful access to employment opportunities. I must say that our providers were great partners during the pandemic, even though in the early days of the pandemic, when everything was shut down and operations moved virtually, they continued servicing our customers. You can see that by our invoices that show the participation of our customers, how the providers engage the customers. So, it's nothing definitive can be stated at this point about what it would look like 3 or 6 months from now, but we are ready and we are serving customers. One of the things that we would not go back to is the heavy reliance on paper, because we see where the customer portal is so meaningful and is serving as a great tool for customers. So that's going to enhance. We would still have the opportunity for customers who may not, or who may have challenges, as you mentioned, Damon, not that literate, and still, although they have been trained, they're still waffling between. I don't feel at ease using technology. So we still have that opportunity for customers to submit through paper. We are pushing paperless for their benefit as well as our benefit, but we still have that opportunity available for those who wish to do that. I don't know if my colleagues want to chime in on anything else.
I think you covered it beautifully. The point that I will add is that you can't put what we've been through back in a box. So from what we've learned in our space, I think, my mind always moves to data and like thinking, where can we go from here and what can we learn from here? So for me, it's a SWOT in my head, right? Where are our strengths and what do we do with those? What do we do with that? What are our weaknesses and what have we learned? And how do we bridge that gap? What are our opportunities? And I think this is where one of those opportunities, right? This conversation and our approach to PPE, this conversation, I think, is tying in a lot of the opportunities that we've taken to just learn and grow, but then it's left us with a lot of questions that we're still trying to answer. And then where are the threats? We were not expecting to go through a pandemic in 2020. However, this allows us to plan forward. So if anything were were to happen like this, unfortunately, we would have a better grasp on how to approach it and how to really get our arms around it. So innovation is going to continue to happen. We're going to continue to think outside of the box and really push where we can go. And we're going to have great people willing to lean in and learn. So from there, we won't go back. We'll continue to learn forward.
And always uppermost in our mind as an agency, what is the right thing to do? What is right? Which is the right pathway? So that's our North Star. What is the right thing to do here?
And I see Sandra has a question, but I want to piggyback real quick on Daywan's topic of data. given that now everything has moved virtual and away from paper, we know that companies have to get new servers and they have to have the capacity to collect and secure the data. Were there specific steps that you would like to share about what states should consider when going in, or tribes should consider it when going in such a direction? Because there will be a lot of data that's collected, and your IT folks have to walk hand in hand with you, I'm assuming, and making sure that that data is safe, accessible. So any points to ponder or insights you want to give on that front?
So I want to say just one thing, and then I'll pivot to Monet because she worked closely with our IT folks. So one thing I would say is that states should ensure, not all states may be fortunate as DC to have an internal IT division that, and but if you do have an internal IT division, be very collaborative with them. Forge that relationship. So when you have an idea that it's just an idea, you don't know where it will go, you can discuss that with them, and they would be able to make it bear fruit. So that partnership with your IT team is very, very, very important. I know IT sometimes we can be a little challenged by their interactions with us, but I do want to say on the record that we have a great internal IT team in the Department of Human Services in DC, and our division has a great working relationship with that team, and they understand when we say something. It may not be IT speak, but they understand what we're trying to say, and they can bring forth something that is what we had in mind but couldn't articulate. But I want Monet to talk about it, since she took the lead on working with IT for this particular project. Please, Monet.
Anne's point is extremely well taken. I mean, again, if you are a state and you have that opportunity to be able to have internal IT staff partner with them, because it works both ways in terms of the communication. There were some areas that I would have never thought to ask the question on, and we talk about security. So for the program, we often think about, this is what we want the beginning and the end to look like. But the in between is where the IT department would really help to ensure that the execution can in fact occur, making sure that everyone is safely able to transition with the system that's being created. I say that because even with working with the eDoc and e-signature platform that we're using, the main auspice for why we needed to include that conversation about storage was major, because many applications that we use, they have an internal system within that application that you're sort of bound to, and you have to sort of stay within the confines of that system. Our IT department said, no, we work with far too many customers. We need to make sure that we can control not only the narrative, but that we can be ensured that the data that's coming in, we know where it goes, where it is, what it is, when it came in. And so again, all of that, those intricate details were brought into the creation of this portal. So if you heard me mention during the narration that the customers or providers have to click submit all documents, right? If they're using that feature, and when that happens, it's taking the documentation from the middle application to that storage space. So there are literally two spaces that the customer's information are currently being housed. And the reason for that is because we have to make sure that access to that information can be done at various levels of security. So it is a conversation that states are encouraged to have, again, whenever there is any discussion about working with both customers and our partners, and not just at our internal staff, because remember, with this system, we're working with 3. So there are various security measures based on the role in which you perform with our agency.
Great. Do the TEP contracts include staffing social workers with the providers? We know that you mentioned you're moving to more of a case coaching model and away from the traditional, I guess, case management type model. So on that question, with the TEP contractors, do they have social workers on site? Can you go into a little bit more detail also about I guess, the communication train. If I'm a customer, I entered my data while I'm at the Metro at Union Station. Does my case coach back at the office get a notification? Does my TEP person get a notification? How's that communication going? And are there social workers in the mix?
So I'll take about social workers, and if they want, and or Monet talk about communication piece. So I did respond in the chat that the contracts do not include staff social workers per se through our provider network. However, many of the employees within the providers network do have social work degrees. But barring that, internally, DHS ESA, we have social workers integrated in the TEP program, which are in one of our offices within the division. And we have a great working relationship with our Department of Behavioral Health partners. So we provide that wraparound service. In addition to case coaching, we have supportive services for behavioral health through the social workers in our hired by DHS, ESA, Economic Security Administration within DHS, as well as our partnership with the Department of Behavioral Health. And if anyone else has additional questions on that, I'll be happy to elaborate.
No, I think you covered it.
So communication, I think there was a question on the communication piece.
Yeah, if I was wondering, because if I do my online thing on my mobile device, does a worker at the DC office get a notification, hey, Damon's stuff is in there? Does the TEP provider get a notification? And then the whole thing is, I'm a hand talker, and the whole thing is just going through this virtual space, but making sure that the customer doesn't get lost in the virtual communications. Does Monet, not to say you're one of the people, but does the Monet then call me and say, hey, I got your paperwork, this was missing, or something like that?
Do you mind if I take that one?
Sure,
Yeah.
sure.
The way you explained it is absolutely correct. So literally, as it stands today, there are various ways in which the direct case manager will be made aware that the customer has submitted documentation. And that current communication is done via email. And so that checks and balances is in fact in place. So well before the documentation even moves to the middle application, that customer and case manager had that conversation. So what happens is now in the middle application, the approval and the review process basically can take place. So again, that sort of wraparound logic is embedded in the way in which it functions currently.
And there is a process flow from the customer to the case manager to the secondary case manager. And, so it's all embedded. That logic is embedded. And I think that's the beauty of seamless docs. It may not be the best solution for everyone, but at this point in time for DHS, we use seamless docs as the solution for us with seamless, with virtual proceedings.
And I'm going to end it off here unless another question comes popping in. Thank you, Chris. I'll use orchestrate my stories too. So DC, you made tremendous, do case managers have a certain amount of time to respond?
Great question. I'll actually take that one. So we ask that they do respond timely. So the normal written contractual agreement is within 24 hours to respond to that documentation. As a result of that, the same logic applies to that information that is in the middle application as well. And the response to that literally is informing the customer, yes, I received your documentation, I will review it, or I have made a decision, or you need to provide more information. Whatever that response needs to happen.
So I want to wrap it up by just asking you one last question. And hopefully all three of you can chime in. What still keeps you awake at night? You made tremendous progress. You've You've implemented a rapid response activity for DC residents, but what still keeps you up at night as this continues to unfold and the world keeps moving on during COVID? What has you staring at the ceiling?
Okay, I could take it since I see my colleagues looking. I'll take it because I had this question in a different setting last week. So I'm not going to use a response from that setting because that was a completely different setting. But what keeps me up at night is to ensure that our residents, particularly engaged in the employment and training program, that we're doing right by them. That what we do will ensure that that it can lead them to it can sustain them according to what their needs are. That our programs are right. That the TEP network, the TEP network that we have, work contractually are doing the right thing. That internally, we as an agency in the employment, particularly my division, employment and training, are doing the right thing. So just to make sure that, like we created this, the seamless doctor PPE, that there aren't any interruptions in the process flow, because we have, as I mentioned earlier on in the presentation, we do 100% participation. We audit, our office audit 100% of participation, and we don't do a random sample. Everyone who engages in an activity is audited, and that's on a schedule as well. So I want to ensure that the process works well when customers submit their timesheets or anything to cover their participation hours, that works well, so that when it comes to being audited, everything is, all checks and balances are in place so it can be approved and then go on for payment. Because I want to ensure that customers can eat as we do. So that's what keeps me up at night. Should I pivot to Dewan?
I was trying to get the words out.
Yes, she was. Yes, she was.
I was trying to get the words out. I honestly say one thing that keeps me up at night is constantly trying to figure out how we keep the dialogue going and making sure that our residents feel heard, and that they also recognize that when we approach the work, we approach it in a way where it's with good intentions. And that with everything that we're doing, we want to make sure that it's never to add anything unnecessary to the process, but sometimes it may be a bit difficult getting to the end goal, but please believe that we're putting in 110%. So I really want to keep the conversation going, and I want our residents to see that. I want anybody who connects with DHS to see that and recognize that we're going to continue to learn, and we want them to continue to tell us how we can continue to grow to meet their needs.
I think that's key. The other part of that too is that the work environment is important to me, and the work environment that we're in fosters that help mentality, And so even from this call and this conversation, just really bring into mind, like, there is work that can still be done. And so the conversation hasn't ended, to Dawan's point, but we can push the conversations forward, and our customers do a great job of that. Staff do a great job of that. Everybody who we work with really does a great job in sort of thinking about how we can do business better, how we can do working together, building relationships better. And so that challenges me to really think about my responsibility in aiding in making sure that not just for district residents, because here's the reality, our customers can move all over the place. They really can. And so whatever relationship we were able to build, even in that one interaction while they were working with us and eligible, I hope that they're able to take that to the next place and next space and time that they do go to. So again, it's all about, for me, moving the conversation forward. That's important.
And that's the perfect close. Thank you, Anne. Thank you, Monet. Thank you, Dewan. Thank you, Jason and team. Thank you, Steve at BLH and his team. Everything went very seamlessly. So I hope that you got a lot of information out of this. And I also encourage you to reach out to your colleagues in DC. I know that a lot of states and tribes and counties are looking at different strategies to ameliorate some of the challenges that came down with regard to COVID and the technology. So reach out to DC. Their information is in the conference materials. We'll give you 10 minutes, but I definitely encourage you to go on to the next session, which you get to choose between one of three. You can either go to an innovation station, which is presentations from your colleagues about different innovations they've adopted at the state or tribal or county level. The exhibit hall will be opening up at 4:15 also, and also Brain Date. We added a Brain Date today that may be interesting given current world events. There will be a discussion around Afghan refugees and the entire refugee process and what TANF programs are doing. That'll be led by your colleague, Babs Roberts from Washington. Again, please fill out the survey. It's in the chat feature. We do want to get your feedback, and I'll close out with that. And everyone have a good afternoon or good evening.
Thank you so much.
Thank you so much.
Thank you.
Thank you.